to fit this into our budget.
Okay. And looking again at these 14 use cases, is there a use case that the developers of this product should have considered that would be a logical application of this type of data that would be particularly interesting to you?
I think the only thing that I'm not seeing and I might be able to capture is just tracking referral patterns or patient journeys is kind of the way that we look at it. Just how patients are moving through. How are they moving through some of these specialties? Like, are they starting for the last one that we looked at? Are they going from primary care physician to being referred on and kind of understanding any local referral patterns? I think that that's a difficult piece of information to get, and I think there might be within this data the ability to kind of understand when patients are presenting, who's diagnosing, when are they referring on, at what point are they referring, how many different specialties are the patient seeing. I think it seems like you'd be able to get some of that information out of this as well.
Okay. The last slide I'm going to have you look at, slide 17, is what the developer of this product really kind of sees as the encapsulated value proposition with three key aspects. The first one is the only product in the market that can deliver that weekly medication data, again, within 10 days of each prior week's close, with those clinically robust patient profiles. Again, you've got the doctor's notes, the nurse's notes, and the natural language processing that pulls out those important data points. It would enable a pharmaceutical company to quantify the brand opportunity and with tracking performance to specific segments of the population, but recalling that example of the more severe psoriasis patients on the Otezla case who happen to have been treated by dermatologists. And then it would illuminate the intersection of the clinical and cost dynamics because you have that ability to look at the written versus the filled conversions by payer and also by geography. So just looking at, we've gone into a lot of depth for Product X prior to looking at the value proposition, but would this kind of be, let's just say you were having lunch with a colleague tomorrow and you said, I've just learned about Product X. Would these be the three key value propositions based on what you've learned, or would it be something different?
No, I think these are the things that I highlighted out of, the things that I think are unique, being able to get that patient level, more detailed information, and then, the written to filled. I think the only maybe critique or question I would have around it is in the last one. I don't necessarily think that that's only illuminating cost dynamics. There could be a lot of different reasons why, prescription is written and not filled. Is it the patient getting cold feet? Is it lack of information? I don't think it's necessarily just cost for that reason. But I think these are the key differences that I see with the product.
Okay. So based on what you've seen today, do you believe the developers of Product X have effectively explained how it can benefit pharmaceutical companies or biopharmas?
Yeah, I think the case kind of puts it into perspective of what you'd be able to see, and I think the information that we have is pretty relevant. Okay.
So just what would be the likelihood, you talked about you'd be interested in learning more. Would you be interested in buying this? And would you think that it would, assuming that you were to buy it, would it be an adding to your portfolio or collection of data sources, or do you think that it would displace one or more of the ones that you use?
I don't think that this could replace everything that we have. I think it would be in addition to what we have right now.
Okay. If it couldn't replace all of what you're using, could it replace maybe one of what you're using?
Potentially, yeah.
Okay. So we've talked about, you think that it's relatively unique.